Okay.
So thank you everybody for joining us. Unfortunately, I have to pass along Professor Noam's wishes for a good session. He's currently in Tokyo, just arriving for the big conference going on over there, starting on Sunday. So unfortunately, he had to miss today, but he is very excited, as am I, for a really well and interesting, informative session for today. Which was organized by our friend and fellow board member of IMMAA, Zvezdan, who will be handling the moderation duties for today. So Zvezdan, please take it away.
Yeah, well, first of all, I would like to thank you, Jason and Professor Noam, for providing me with this chance and opportunity to do introduction to our and my fellow colleague, Professor Pablo Medina. Professor Medina is assistant professor at Canadian University, Dubai. He has a PhD in corporate communication from the University of Navarra in Spain. And he will be delivering a lecture, Building Meaningful Brands for Hospitals, a branding model for the next 20 years, 2023-2043. Professor Medina is also an expert, and his field of expertise is in health communication. So this is after COVID-19 actually issues that we have globally. This is a very interesting topic. And he has also served as a professor at several universities in Switzerland, notably its University of Geneva and Spain, International University of Catalonia. He has also worked for several years in healthcare companies, Publicis Conseil France, Clinica University of Navarra, and led consulting projects about health communication at top international companies such as Sanofi, Simfa, Hospital Mutua Terrassa, etc. He attended actually about 27 communication conferences. He did write professionally 85 articles and publish 18 books. I would also like to point out an interesting information that his forthcoming book on the management of PR agencies will be published by Lisbon publishing company Media 21. And right now, after this brief introduction, I would like to ask Professor Medina just to, your floor is yours, and please you can present your actually online lecture now. And later on, after 25-30 minutes of the lecture, we hope that we are going to have a number of very interesting questions, and I invite other fellow colleagues also to participate at their actually convenience. Thank you very much. So Pablo, please just introduce.
Okay, so thank you very much, Zvezdan. And thank you also Columbia University IMMAA Association for this opportunity to present this session about health communication. So good morning, good afternoon, and good morning, everyone. And thank you so much for attending this session. So today I will be presenting this content about how to build brands for hospitals during the next 20 years. So to do that, I will focus on different areas. So first of all, on the hospitals brand crisis. Then I will explain how different institutions try to help the hospitals to improve their practices and this way improve their brands. These institutions, so this is universities, tech companies, and after that, experts in finance and management. And finally, based on this input, so I will present the branding model, and the last section, this is the 10 branding principles. So this is some ideas that brands, not only in healthcare, but also in other industries, such as media companies or governments, they can consider to build their brands during the next 20 years. So this presentation, as you can see on your screen, so I focus on the United States because, well, so this is the objective of this. So, sorry, I will put just this stuff like that. I think it's better. So as I focus on the United States, but if we do this exercise about other countries, so we will have similar results. As you can see on your screen, so for the hospital industry, so this is one of the most important ones in the country in terms of number of employees, number of hospitals, number of investment for medical services, but also for administrative services. The United States, so this is one of the countries that invest the most in healthcare, especially if we compare that with other countries such as Germany or the United Kingdom. But despite this investments or this industry, as this is the case in many other countries, by the way, so is facing a crisis in terms of communication and in terms of branding. And 3 reports prove recently that. So the first one, so this is this report published by Interbrand in 2022. One of the main conclusions, it was that the American industry, I mean the hospital industry in the United States, so they need to revamp, redefine, or reinvent, as you prefer, their communication strategies and especially their branding strategies, because they have some problems related to credibility. Another report published by Edelman, and of course in this context of COVID-19, so proved that 50% of Americans this year in 2023, so they feel that hospitals, they are not ready to address this kind of crisis such as COVID-19. And finally, in 2021, so ABAS, this agency headquartered in Paris, France, so they published a report not only about healthcare brands, but about every kind of companies, every kind of brands. And they prove that most people in the United States, in Canada, but also in our countries, in Europe, so we don't care if 75% of brands disappear, which means that something from a communication perspective or from a branding perspective is not, I mean, these institutions, they are not working well, including hospitals. So this crisis affect the hospitals at many different levels. So this is, as you know, so these institutions, they interact with many stakeholders, from patients to employees, public authorities, media companies, or suppliers. So this crisis, this related to reputation and credibility, so affect these institutions. In some cases, when this crisis become really serious, so hospitals, they will take different decisions. Some of them so can be firing people, closing departments, and in some cases, when the situation is really difficult, and this is the case in many hospitals, not only in America but also in other countries, so they can even decide to close their doors. And as you know, when these institutions, they close their doors, so mortality rates increase, especially in rural areas, as it was proved by this professor from Harvard. So as you can see, the hospital industry so is facing this crisis at many levels, from an economic perspective, from a public health perspective, and also from a communication branding perspective. So as I said before, so there are different institutions that try to help hospitals to improve their practices, and this way, so improve their brand and their reputation. Some of these institutions, so for example, so this is universities. So what they are doing in universities, what we are doing in universities is an interesting question, by the way. So in different universities, so just they have implemented health communication centers where just different researchers, so just they publish papers and books, book chapters, and different publications to analyze what is happening in these organizations. So normally this research is especially a qualitative research. So it means that most people in America, but also in other countries, especially in Canada, by the way, in Quebec, there are many experts in this area of health communications, especially in Montreal. So they analyze how, for example, hospital brands affect employees' sense of belonging, or patients' medical outcomes, or internal functions in these organizations. But one of the best experts in this area, I think you can read his name just on the bottom. This is Scott Rattan. He used to say that in health communication, so we need to use different quantitative methods, and we need to develop models, because if not, this is an area that it will never be well developed. So that's why some university professors, they collaborate with other institutions, with external institutions such as Brand Finance, and they publish this kind of quantitative reports, such as you can see on your screen, so the most reputed hospital brands in the world. So besides universities, there are also other kind of institutions that try to help hospitals to improve their practices, and this way improve their own reputation. Some of these companies, so this is the tech companies. according to the World Economic Forum, so there are 5 main areas that will determine this healthcare industry during the next years. So this is artificial intelligence, this is 3D printing, this is virtual reality, smart bandages, and many different technological tools. So you can imagine that many of these companies, they invest in healthcare because this is a good idea from an economic perspective, according to Forbes. So for example, artificial intelligence and healthcare, so this is one of the most important areas for the next years. But these tech companies, they collaborate with hospitals also because from a public health perspective, this technology helps these institutions to improve patients' experience. So thanks to artificial intelligence, for example, many institutions, so they are saving billions at many different levels and in many different medical departments. And thanks to virtual reality, so hospitals, they are improving patients' medical outcomes. So thanks to 3D printing, for example, so hospitals, they optimize their internal processes. As you remember, I said in one of the first slides, so you saw that one of the most important costs in America, this is not for medical services, so this is for administrative services. So thanks to technology, so we can address all these problems. So the technology, so this is useful for hospitals from a public health perspective, but also from an organizational perspective. That's why so many institutions, so they implement what we call telehealth. So as you know, telehealth, so this is something that was developed by Professor Louis Larengue in Toulouse, in France, and some years ago, 50 years ago. But since then, so many different institutions, so they have implemented telehealth, including different hospitals in America. And thanks to that, so they improve different processes and they save money. And finally, so they also improve, for example, patients' adherence to medication, which is really important from a public health perspective. So besides these universities and tech companies, there are also other kind of institutions that try to develop projects to help hospitals to become better organizations. Some of these institutions, so they are the different experts in finance. So different professors, for example, in Harvard, but also in other universities. So they have developed new financial models. So for example, the value-based payment method, something that in some states is not used, but in other states, in different hospitals, they are implementing that, such as in Oregon, and this is something that is working for different institutions. Other hospitals, so they other experts in finance, so they develop what we call the cross-functional collaboration. So this is a different way to design or to calculate the bill for the patients. Thanks to that, so different hospitals, as you can see on your screen, so they are saving millions. And finally, so other hospitals, so just they resort to the circular economy to change their internal processes and save money. As you know, the hospital industry in America, but this is the same in all countries, this is one of the industries that face the biggest public debt. So that's why all these kind of initiatives, they are really interesting. So besides these financial models, so for different experts in business, so they also try to help these institutions to improve their processes. So according to Deloitte, hospitals, they must take different decisions from a business perspective. So they must decide which kind of hospital they will become within 20, 30, or 40 years. They will remain a global hospital, such as now, or Cleveland, or Johns Hopkins, or so many hospitals who have different medical departments, or they will become hospitals specialized in some areas, or hospitals specialized in some technologies, or they will focus, for example, on artificial intelligence or telehealth, or they will focus on telehealth plus cardiology, or they will focus on telehealth plus cardiology plus chronic patients. So they must take different decisions in terms of business. A second decision that they must take also from a business perspective, so this is which technology they will implement. Unfortunately, most institutions, they don't have money to implement everything at the same time. Artificial intelligence, robotic surgery, Internet of Things is just not possible. So these institutions, so they must focus on something, and this decision will affect their business. And the same for technology and how to implement technology to change the hospital, the buildings, the room, and in just the waiting rooms, for example. So this is the same, how to introduce technology to change these buildings or these patients' experience in the hospital. So this is according to Deloitte. So by 2040, these institutions, they must take different decisions. But some of these hospitals, they have already decided. For example, the General Hospital in Tampa, so they already have focused on virtual reality. Thanks to that, as you can see on your screen, so they are saving millions. They have cut 20,000 excess days for our patients, and they have a reduced length of stay, which at the end of the day, this is money for the hospital and better conditions for patients. Other institutions, such as this hospital in New York, so they have focused on robotic surgery. And thanks to that, so I think you cannot see this stuff, but just they can help, they help someone, so they help Amanda to walk again. Another institutions, such as Mayo Clinic in Rochester or Jacksonville or Phoenix, so yes, they focus also on this smart initiative, such as virtual reality, and they improve patients' and medical outcomes. So based on all this content, as I said before, so hospitals, they face a crisis from a branding perspective. Different institutions, they try to help hospitals, so universities, tech companies, experts in finance and management. So based on all this content and based on all these different papers that I am reading and publishing about health communication since 15 years, so I would like to present a model for a branding model for these institutions. Of course, it's just a proposal. Every hospital, every country, this is a different story, of course, but this is just a proposal. So to develop this model, so I resort to this book published by Douglas Holt. So just he explained how brands, they try to adapt to different social ideologies. So societies, they have different social ideologies. Based on that, companies, they take decisions and they develop their own ideology. And based on this ideology, so companies, they implement their communication strategies. So I will follow this logic to present the past, the present, and the future of health communication. To do that, so of course, it's just a proposal, so we can debate about that after that, of course. So I focus on this timing, so from 60 to 2000, so one of the main social ideologies for companies especially, so it was competition, profits. In the present, which is 2000 and 2023 today, so the main ideology, so we react, as this is sometimes the case, against the past. So just the ideology, this is consumers' rights. And for the next years, so one of the main ideologies, and again, it's just a proposal, so this is sustainable innovation. So based on that, I will present how these institutions, they have communicated during the last years, what they are doing today, and what they should do during the next years. So concerning the past in health communication, as you can remember, so during these last years, most of these hospitals, so they focus on the idea of doctors' credibility. And so they are experts in science, they are experts in medicine, in cardiology, in oncology, in different areas. And most of these institutions, so they try to use this idea to convince and influence patients. But these patients, when they went to hospitals, so of course, they saw that some doctors, they were really professional, or some nurses, but in other cases, it was not like that. So they saw also some doctors doing medical mistakes, some hospitals that were, and people, they were not working professionally. So patients, they felt frustrated. So to address this frustration, so these hospitals, so they focused the communication strategy in one main idea. And it was the idea of doctors as a scientific researcher. So it was a way to say, yeah, we are human beings, so that's why sometimes we are doing mistakes, but we remain experts in science. So we are experts in medicine, we are experts in different medical fields. So they try to focus on this idea to build the hospital brand. We know what we are doing in these organizations. So as you can see on your screen, sorry, I play with that at the same time. So as you can see on your screen, so many of these hospitals in the 60s, in the 70s, in the States, but if we do that about another country, it will be similar. So they focus on this aspect of doctors' credibility, or nurses' credibility. In 2000, so some social disruptions will force these institutions to change their communication strategies. So some hospitals, they will become global organizations. They will implement different business models. Patients, they will become more active. They will fight for their rights. So if you remember, I said before, the main social ideology in the present, it was consumer rights. So hospitals, they follow this social ideology, and they focus on patients' rights. But patients, today in the present, we go to hospitals, so we have the same frustrations in some cases. So some doctors, so just it's not their fault, it's just for management reasons, but they only have 5-6 minutes to take care of each patient, and patients, they are not happy with this decision. Some hospitals, they are lying in different advertising and in different advertising campaigns. This business pressure so force hospitals to work in a different way. So again, today many patients, they think, well, what hospitals they are doing and what they are saying is not the same. That's why again they feel frustrated today. So to address these frustrations today, most of these hospitals, they focus on the idea of empowered patients. So they try to build emotional relations with patients outside the hospital, inside the hospital, because this is the way to influence the perceptions and make them think that the most important element in this process, this is not doctors anymore, this is not patients anymore, this is patients. That's why if you analyze how some of these organizations, they communicate today, so they focus on these emotional aspects, they focus on the idea of patients empowerment, they resort to social media and mobile apps, just of course to push patients to communicate, but also to control what they are saying about the hospital, because patients and they are becoming also public opinion leaders, and other institutions. So just they focus also on this idea of how doctors, they can establish new emotional relations with patients. This is the main topic for this campaign, from this beautiful campaign, by the way, from UCSF, but unfortunately I don't have time to present. I can send you the link after this presentation. So today, in 2023, so there are again new social disruptions that will force these institutions to change again their communication strategies. So of course, virtual reality, artificial intelligence, and all these technologies so will force hospitals to change their business model, to change also their communication strategies. But this is not the only social disruptions. Patients, they are becoming more and more skeptical with different institutions. They ask these institutions how you are addressing climate change, how you are addressing sustainability. So they want hospitals to assume a social responsibility. So what will happen during the next years? This is that most of the, and this is the model I want to present. With you. This is that most of these hospitals, so they know that they have the knowledge and they have the technology, but they know that patients, they want to become independent. They want to use this technology and they don't want to go to hospital. They prefer to use their phones or mobile apps or platforms or patient portals. So the problem, this is that many of these patients, again, during the next years, so they will have some frustrations. The three most important ones, this is that some patients, they don't have the skills in health literacy to use these platforms. The second one, this is that some patients, they don't know how to use these platforms. And the third one, and this is for me the most interesting one, this is that many patients, they refuse to use these platforms, especially elderly people. They prefer to interact with doctors. Why they should speak with chatbots or I don't know which social media platforms? Health, this is a human right. So people, they prefer to interact with doctors. So what I propose for these institutions for the next 20 years, how to build the brand for this hospital for the next 20 years, this is to focus on the idea of hospitals as social leaders in virtual health. So it means that these institutions, they should not be isolated institutions in their buildings waiting for people who are sick, who got cancer or depressions, or I don't know what, and who contact doctors because they need some help. These institutions, they need to address social issues. They need to address many different problems that people, they are facing in companies, in the private sphere, in the public sphere, and also in the social sphere, and put healthcare as one of the most important elements in the public agenda. So in other words, so the main branding strategy that I recommend, again, is just only a proposal for these hospitals. So this is to become social leaders and lead a social change in different cities and different countries. So in order to present, and just I finish in 10 minutes of this presentation, in order just to present how to implement these abstract ideas into real campaigns. So I would like just to present 3 initiatives and 1 advertising campaign. So what the first initiative, so this is virtual universities for patients. Today, many hospitals, they have these patient portals, and patients, they can check some information and they can share some inputs with their doctors. But during the next years, these institutions, they should focus their main efforts in terms of branding on help patients to use this medical information to develop personal plans for their own healthcare and integrate these personal plans with the hospital's medical protocols. Today, this is a headache to do that, but during the next years, so this is it will become a priority and just a branding priority for these institutions. A second initiative that I would like to present, so this is the healthcare challenges in cities. Maybe you have read something about what is happening in this part of the world, close to Dubai, in Riyadh. So just they want to build this big city in the middle of the desert by 2045. They focus on business, but they are not really putting healthcare as one of the main elements in these projects. So hospitals, they must fight for that. So they must publish reports, do research, organize events to put healthcare as one of the main priorities for the next challenges in cities, in countries, or in continents, because this is the way to protect in an efficient way patients' rights to healthcare. The last initiative that I want to present, so this is, I call that promoting healthy capitalism. As you know, so every year 400,000 people die in the world for heart problems provoked for long working hours. This is not Pablo who says that. This is the World Health Organization in Geneva, in Switzerland. So which means that something is happening in companies in the States. So you faced recently 1-2 years ago this great resignation. Also, in so many people quitting their jobs. This is what is happening, by the way, now in Europe, in some countries. So it means that something is happening in these industries. So again, hospitals, they cannot be passive institutions waiting for employees sick to go to these institutions, but just they need to lead a social change, put healthcare in the public sphere, in the private sphere, and protect patients' rights to healthcare in a more proactive way. So besides these 3 initiatives, I would like to present just an advertising campaign that I have developed, but just I will present really quickly this campaign. So this is a campaign to promote an imaginary hospital that I call XYZ Hospital. I am not the best one for naming, by the way, but just the best concept, the concept for this campaign. So it will be to protect patients' rights to health. So it means that regardless of what is happening in society from an economic, political, or social perspective, in this hospital, the main branding idea, this is to always protect patients' rights to healthcare. This is this hospital cultural and political authority. So sorry, I don't have time for this technical stuff. So to present this campaign, I would like just to present just 3 characters and 1 setting, just for you to imagine the storyboard for this campaign. And then I will just put a video to present this campaign in a more symbolic way. So the basic of this campaign, the main principle for these campaigns, this is that we will have 3 main characters. So you must imagine a video, a corporate campaign with 3 main characters. So the first one, so this is virtual patients, so people like you or me, but not in 2043, but in 2043. So according to the WHO, again, so most patients, so we will be at home, we will be chronic patients, we will interact with doctors through technology. but we will interact not only with nurses and doctors, we will also interact with health engineers. This is all these people working for hospitals, especially trying to develop this institution from a technology and business perspective. This is the second character. And the third character, so this is our company, this is our hospital. Okay, so this is the three main characters for this imaginary institution. So concerning the setting for this campaign, so you need to imagine that we are in New York, but not in 2043, in 2023, but in 2043. And we are in this XYZ hospital boardroom where the finance director, so yes, he's explaining that in 2043, because of a legal decision, so for most American patients, so they must pay $5 every time they want to access the online medical record. Many hospitals, they have implemented that because this is something from interesting from a business perspective. And in this presentation, he mentioned also that from a public health perspective, and according to a patient association report, this decision is not useful for patients because many patients, they will not pay for that, which will negatively affect their health. In the next slide in this presentation, this finance director, so yes, he put a new a big figure, a big number like that, and this is just 200. And he explained that 200, this is the number of millions that normally this hospital had planned to invest in advertising for the next year in 2044. But given what is happening in the city, in the country, so they have decided to use this money to implement a system that allows patients to access their online medical record for free. Because in this hospital, where even patients associations, they attend these business meetings, so accessing medical information is not a business opportunity, but this is a right. When hospitals, they respect these rights, hospitals, they become reputed institutions. And when hospitals, they become reputed institutions, so they can lead this social change that I have mentioned previously with cities, with healthy capitalism, and with the different institutions. So to present this campaign, and just I finish in 7-8 minutes, I think it's fine as well for the for the timing. I would like just to present a short video that I have produced, thanks to my friend also Ode Amaite, that I say also thank you to Ode to help me to produce this video. So in this video, so you need to change these three characters by three different protagonists. So virtual patients, so common patients, they become common birds. Health engineers, they become, it was not difficult, predatory birds. And our company, our brand, become gray parrots, because as you know, this parrot, so and they have proved that from a scientific perspective, he has a special sense of community and a special sense of compassion. So I will just showcase this short video. It's just 1 minute, and after that I will finish this presentation in 5 minutes. Okay, so 1 second. Let me know if you can hear this video. I hope.
Grey Parrot's annual ecological meeting. Two great horned owls explain to more than 300 common birds that beginning tomorrow, common birds cannot drink water in the Pisgah National Forest's main lake. This water is only for owls and falcons hunting around the houses close to this lake. Common birds will be forced to fly 2 hours and drink from another lake. Falcons celebrate this decision. They will have more water and will be able to hunt more frequently. One hawk cleans his body claws in the water. Meanwhile, the falcons express their joy for this decision. 2 American robins, common birds, react against that. Flying 2 hours is risky for their lives and constitutes a health risk for baby birds. Suddenly, a grey parrot interrupts the meeting and asks the 300 common birds to follow him. He brings them to another lake hidden behind 20 sequoias. Birds only need to fly 20 minutes. Owls, falcons, and hawks have never gone there because they only care about hunting and not about the forest. Common birds celebrate this decision. The grey parrot explains to them how to fly to discover wonderful places in the Pisgah National Forest. XYZ Hospital, as political activist, recruits, educates, and convinces other hospitals to help co-author the myth. Free access to water is a right, not a business opportunity. Healthier birds contribute to reinforce birds' families' influence. Influential bird families lead the change to build a healthier forest where birds have their rights always protected. XYZ Hospital, protecting patients' rights, building healthier societies.
Okay, so just this is the campaign I want to present. I finish just in 1-2 minutes. This is all this. So 1 second. This is all this presentation about health communication. So just based on this content, I was just quickly to mention 10 branding principles that health companies, but also other kind of institutions, from media companies, government, or private institutions, they can use to build their brands within the next years. So these principles refer to focus on meaningful content, integrate different stakeholders in this process, rise the intellectual level. This is what the founders and the pioneers in advertising and PR, they recommend, from Ivy Lee to Bill Bernbach, Edward Bernays, Ogilvy. This is what they recommend to build the brand. Explain what is the brand legacy of the company to the profession, as for example in journalism, what is the brand legacy of this Murdoch family in the journalistic profession in the States, in Australia, and in many other countries. Educate CEOs mentalities, educate CEOs about what branding is and how it influence the business. And the last principle, so this is a resort to the true content. So forget about all these empty influencers and go to universities, public opinion leaders, because they have the true content that is useful to develop this brand. And finally, so just explain employees' roles and address social issues and social debates, but not for doing business based on these social issues, but really to address these social debates. So when brands, they communicate in this way, so they are not following other companies' ideologies, but they are really creating their own ideology. And this is when brands, they create their own ideology, that they become really meaningful for society. So this is what I wanted to present today. If you want me to share the references, I can send you by email. Okay. Thank you so much.
Well, thank you, Pablo, for your very interesting and detailed lecture, actually, in health communication. There is no doubt that it's a very impactful, actually, field and subfield in communication and also in natural science. Now, I would really like our fellow colleagues and attendants of this, actually, seminar to ask some question. I've noticed many professors' name, very established professors from actually all over the world, which is always the case with our seminars. And I would really appreciate if any of them would like to ask a question or make some comments. So please feel free to engage in a communication or ask questions.
So Zvezdan, if no one else has raised their hand already, I can't because I'm the host. So if you don't mind.
Sure.
I do have at least one question that I would like to ask. And obviously, we focus a lot on media companies with IMMAA and things like that. So I would be curious, how could other companies, maybe more media-centric, more interested in that realm, leverage the same rebranding?
Yes, so thank you for this question. So I think this is in healthcare. So yes, we protect patients' rights to healthcare. In media companies, so we protect people's rights to information, to have clear inputs about what is happening in society. which is more and more difficult because all these companies in different countries, this is the same from the States to Australia, Spain, or different places. So media companies, they have their own business interests, their political influence, and their different business pressure. So I think this is a little bit the same. So how these media companies, they will guarantee that people, they can access a clear information and objective information without this business, political, or social bias. So I think this is something that can also be applied in to many of these media companies.
Okay, I just yeah, there's a Professor Wirt from University of Tennessee, Professor Emeritus. Professor Wirt, just hello. First of all, thank you for attending the seminar, and he might have a question, so please go and whatever.
Pablo, what you're talking about in many ways is huge cultural change in the medical industry, and that's very difficult to achieve. Could you maybe talk a little bit about how you think medical organizations should go about changing their culture in order to affect some of the changes that you talk about?
Yeah, thank you so much for this question. And in fact, this is the main problem. So I think this is not only hospital, this is also schools of medicine. I don't know how many professors and how many researchers they have published, especially Diane Berry in University of Reading, somewhere in the UK. They have published so many books and so many papers to prove that communication saves life, that doctors and nurses' skills in communication is related to 60% of medical mistakes in different institutions. And even like that, in many schools of medicine and nursing, so they are not implementing courses about interpersonal communication, about how to communicate with different kind of patients. So I think this cultural change, this is the most difficult one. And even myself, I work in a hospital in a communication department, so I know how difficult it is to deal with doctors. But this is what experts in communication, they should address. And I think I have a time for that, but I always mention to students that the pioneers in advertising and public relations 1 century ago, all these Berbach and Bernays, and I believe when they contacted these companies for the first time in Chicago or New York or I don't know where, and these companies, they were also facing problems in terms of recruitment, in terms of productivity, in terms of benefits. And these people, they explained that thanks to communication, they could address these business problems. I am sure that in many companies, just they tell them, just leave my office. I am not interested at all. But in other companies, they understood. So I think this challenge, this is what experts in health communication, they must address during the next years. How to change doctors, especially doctors' mentalities about communication, but not when they are in the hospital, when they are already in the school of medicine, in the school of nursing, and especially also when they are in the hospital. But I know it's a big challenge. Yeah, this is true.
Thank you.
Thanks.
Well, thank you for a detailed reply, Pablo, and for very nice questions actually that we received. I hope there is still quite a bit of time. I've got about approximately 15 minutes more, so please, if there is any other fellow colleague or professor wishing to ask any questions or make a comments, please feel very welcome. Okay. If there is nobody right now having any questions, I just have a question. I'm not an expert, definitely in health communication, but the lecture is very, very detailed, and you have a lot of experience for about 15 years. I've read a number of your papers too, Pablo, and I just want to know, because we live in the age of digital media, and even many people are talking about post-digital media, quantum media, artificial intelligence, so on and so forth. Wouldn't that be possible for a large corporation such as Apple and Microsoft to create some sort of applications? I think you mentioned application and also artificial intelligence several times, for patients or would-be patients to better communicate with the hospital. Do you believe that is a kind of a profitable technology? We also call it wearable technology, such as smart watches. Would they be able to maybe accelerate this type of communication? Because in actually healthcare, time is very precious, you know, in terms of diagnosing sicknesses. So do you believe there is some room for creating profitable applications, for example? And have you done any research in this field?
Yeah, thank you so for this question. I have we have published some papers about mobile apps of hospitals and different initiatives. This technology is really useful for hospitals, but again, it's related to mentalities. If thanks to technology, these doctors and these nurses, they have more time to communicate with patients, so we can change, we can implement these models, and we can protect patients' rights in a more efficient way. If doctors, if these institutions, they use technology to improve internal processes, fire employees, and just increase the benefits, so we will never address the true problem. The true problem, this is that healthcare, as the United Nations stated in 1948, this is a human right, and this human right is directly related to communication. So the technology is really useful to make doctors and nurses more more performant in this area of especially of interpersonal communication. Two professors in Montreal, Marie-Thérèse Lucieff and Claude Richard, they published a book called The Professional Communication in Healthcare. They publish in French and English, and just this is 1,000 pages, and they explain how doctors, they should communicate, for example, with violent patients, with elderly patients, with children, with chronic patients, with people who don't know how to use the technology. So all this savoir-faire, as we say in French, all this expertise, this is what we should teach in schools of medicine. And based on that, doctors, they should use technology. But before, this is mentalities and then technology. But yeah, both should be implemented at the same time. Yeah.
Yeah, well, thank you for once again for detailed explanation. Basically, I was mostly focusing. I was thinking in terms of a technology, how that could be linked also with some business model. So I was wondering, would you be able to maybe say just a few words in terms of a business model? Have you done any research? Do you see any avenues for creating some sort of a type of a business model technologically to apply these technologies? I don't mean only in terms of communication, but in terms of creating some business model, more entrepreneurial approach. Did you do research, or is that maybe out of your focus of research, or what would you say?
Well, I mainly focus on communication and branding, but this is true that many hospitals they are becoming global institutions, such as Mayo Clinic. They are in 3 cities, in Rochester, Jacksonville, Phoenix, plus the Mayo Clinic health system, and they are also here in Abu Dhabi, in the UAE. But just these institutions, so just they try to also use technology to improve their internal processes. This is what that's why some of them, they are using artificial intelligence, because this is a way to optimize cost and to optimize these different investment. But well, I mainly focus on communication much more than business. Yeah.
I've noticed Professor Wirth is having yet another question. The hand is just up, or oh no, maybe it's not now. Okay, you changed.
No, I took it down, but I have a
okay,
question.
you didn't take down. Okay, I thought that you might have another question. If you have, certainly you're welcome. So just, you know.
Pablo, could you address what type of system, like if you look at the United States, it's a very capitalistic system in terms of the medical delivery of medical services. In other parts of the world, it's much more government supported. Could you talk about, in terms of where you see, in terms of implementing the kinds of future medical profession work that you're talking about? Is it easier to implement that in the US or in systems similar to, let's say, more socialistic medical delivery systems?
Yes, thank you so much for this question. Of course, it depends on each hospital business model. So some public hospitals, well, they are supposed to have their investment guaranteed by governments, even if sometimes this is not the case because they are not doing well from an economic perspective. But finally, this model, so protecting patients' rights. So this is a global idea for private and public hospitals in different countries. But how to implement this idea? So of course, each hospital, so they need to consider the different challenges in each country from a legal perspective, from a public health perspective. It's also true that patients, they have different perceptions about communication. In Europe, for example, or in America, when we focus on health education, so we focus on some content about just how to improve your medical outcomes. In some countries, such as in Latin America, in Bolivia, health education, so this is really basic information. And this is not even doctors who are assuming this role. This is mainly media companies, by the way. So this is many journalists who assume this role because people, unfortunately, many of them, they are not educated. So finally, I think it's this model, this branding model, so this is difficult to implement, but this is a global idea for different hospitals in different institutions and in different countries, of course. Yeah.
Thanks.
Well, thank you. Just let's see if there are any additional comments or questions. So just feel free. We still have a little bit of time here. So just, okay. Let's see. Okay, for now, it doesn't seem that we are not receiving any replies. Maybe we are just here in this part of our world in Asia or Europe a little tired now after having classes because most of colleagues are academics here. So I guess we just had actually class, several of us in Dubai, and we just completed classes. We just moved from classes to actually to online lecture. But in any way, I really would like to thank all of you for being part of this a very interesting and specific session. I'm pretty sure that we at least myself, I've learned a lot about healthcare communication and how important it is. And it is very important, both globally and nationally. Thank you for your inspiring questions and comments as well. And also would like to thank to Jason. Yeah, it's a Professor Wirth again. Is that okay, the hand? So if you have a question, please, yes, you can. Yes.
I was just clapping.
Oh, okay. All right. I
clap.
thought, okay. I thought you had another question. That's so
No.
that's fine. No problem. Thank you very
Okay.
much. Yeah, and I would like to also thank to Jason, our fellow colleagues with whom we've got excellent communication for the last couple of years very directly, and to Professor Noam, who has not been right now here, but he is of course the person who manages all these very international global conferences. And I truly hope that we are going to see many of the fellow colleagues next month. We are going to have also another a very important lecturer. I would like to thank once again to fellow colleague Pablo Medina for a very interesting lecture and his energy, enthusiasm, and actually I'm very glad that also the video and technologically everything has worked very well. So thank you for your participation. And now I just want to say, Jason, you can close the session as you are the actually the main here, our actually facilitator. Yeah.
Thank you so much for that. Thank you so much for that. And so yeah, as he mentioned, next month we will have another wonderful speaker, Greg Harper, who will be talking about future technologies and new types of tech that'll be used in the workplace and in media and creation and things like that. So we very much look forward to that. I'd like to thank today's speaker and of course Zvezdan. We would like to thank you as well for organizing the event and bringing everybody together. And we hope to see you all next month. And everybody have a wonderful day. Thank you so much.
Thank you very much. Thank you.
Thank